to ask the First Minister what the Scottish Government's response is to the Royal College of Emergency Medicine Scotland's reported warning that the NHS Winter Resilience Plan will not be in place in time to prevent further harm to patients and staff this winter.
First Minister.
Well, as we have just been discussing, A&E departments are working under significant pressure, exacerbated, of course, by the pandemic. Pressures are also driven by delays in discharge elsewhere in hospitals, which is why the £600 million winter plan includes a focus on social care and actions to encourage integration authorities to help alleviate delays. Our £50 million unscheduled care programme is working to reduce A&E waits, including by ensuring that people are directed to the most appropriate urgent care settings and scheduling urgent appointments. The Royal College of Emergency Medicine is a vital partner in this work, and the Health Secretary will be meeting them in coming weeks to discuss how further improvements can be made.
Tess White.
First Minister, the RCEM emphasised the urgent need to bolster the social care workforce to help with the discharge of patients from hospital this winter. This SNP government is wasting precious time, money and resources on plans to centralise social care services in 4 years' time. Does the First Minister agree with the SNP MSP Kenneth Gibson that the National Care Service is like using a sledgehammer to crack a nut? Or Michelle Thompson, who said the proposals are screaming a huge risk? And will the First Minister abandon these plans and focus instead on strengthening social care ahead of the looming winter crisis in the NHS?
First Minister.
The National Care Service is about improving social care. It's about better rewarding those who work in social care, and it's about removing any postcode lottery in the provision of social care. So I think a National Care Service is the right way to go. Obviously, the bill is in its early stages of parliamentary scrutiny. There are a number of different committees in Parliament that are scrutinising the legislation, and as we always do, we will listen very carefully to points made and views expressed in the course of that scrutiny. That's the right and proper way to proceed with any legislation. And in the meantime, of course, while Parliament is scrutinising the National Care Service Bill, and as we're taking that forward, we will continue with the steps we're taking in the here and now to improve social care, employing more people in social care, investing more money in social care and increasing the wages of people who work in that sector. Of course, one of the biggest constraints we have right now, one of the biggest barriers to getting people into the social care workforce is Brexit and the ending of freedom of movement, which I think from memory is something that the member supports. So while I'll continue to listen to all points that are made, perhaps she would listen to people who say that we should reverse Brexit and restore freedom of movement to try to help our public services as well as our economy.